Fragile X Syndrome by Mary Suzetta Horn. I am an IEC 509 University of Kentucky student. Dr. Lee and Jung is my professor. As part of our assignment for the class for IEC 509, we had to select a disability area that we were unfamiliar with and do some research on that area so that we could become more familiar with that disability. I selected Fragile X Syndrome. Part of the distinguishing characteristics of Fragile X Syndrome, both physical and developmental, are that a person with Fragile X may have learning problems, they may present with autism, they may have anxiety, and some basic physical features are that they may have flat feet, long face, large ears, they may even have low muscle tone, and they might have joints that hyperextend. Sometimes a person with Fragile X Syndrome, it's hard to recognize in baby and young children that they have that syndrome. But as they age, it becomes more apparent that there are some characteristics presenting themselves. The incidence of a child or an adult having Fragile X Syndrome is 1 in 4,000 males or 1 in 6,000 to 8,000 females worldwide. Most boys with Fragile X have mental retardation, while only 1/3 to 1/2 of girls have significant intellectual impairments. The rest have normal IQs or learning disabilities. The diagnosis for Fragile X Syndrome can be done through a simple DNA blood test. The blood test was developed in 1992 by doctors Ben Orstra, David Nelson, and Stephen Warren. As the research shows, there is no cure for Fragile X Syndrome, but there are medications and therapies out there that can help persons with Fragile X to function better in their daily lives. There is one gene that causes Fragile X Syndrome. The gene is called the FMR1, which stands for Fragile X Mental Retardation-1. This gene shuts down and causes the body to fail to produce a vital protein that it needs. Therefore, speech delay, sensory integration problems, autistic behaviors, anxiety and unstable moods, attention deficits or hyperactivities, intellectual disabilities could occur with these persons. About 30% of boys meet the full criterion for autism. About 25% of people with Fragile X Syndrome have seizures. As families deal with persons with Fragile X Syndrome, the best information that they can get is to be informed when working with those children. The Worldwide Internet Web, it has wonderful resources out there, and it provides a lot of information for families. I found a lot of good resources using WebMD, About.com Rare Diseases, medical doctors, their own doctors can be supportive with the diagnosis of Fragile X Syndrome, and also the FRAXA, the Fragile X Syndrome Research Foundation, had wonderful information out there which can provide support to parents. I really learned a lot by looking at the Fragile X Syndrome, and it's been really a great learning experience to do this research. Thank you.